Hey, where's our growers? I'm Tiff.
I'm Karen.
I'm Seb.
And today we're going to talk about some medical benefits.
We've got a long list of benefits that can come from cannabis. Now, we are not medical professionals, so we're going to tell you guys, go ahead and do your own research when diving into this and to see if cannabis is something you need. And when we read this list, not all cannabis does all of these effects. So it has to do with terpenes, it has to do with, different CBD and THC levels, maybe some cannabinoids. So we're gonna get more deep into which terpenes do what in a future video, but for now, we're just gonna kind of read you guys some of the medical benefits and then we'll deep dive on a little bit on each one.
So the first thing we have written down here is pain relief. So obviously that is pretty broad. There can be lots of things that different people have issues with, as well as different ways to treat it. So cannabis is an anti-inflammatory. So maybe you just worked out for the day and you're feeling like your shoulder may be hurting. You went a little too hard on one workout and you're having some swelling in your shoulder. So you choose to use cannabis as the anti-inflammatory to suppress that pain and the swelling in your shoulder. Maybe you were a farmer for 50 years and you've been working outside in the field and you have chronic back pain that you can't sleep at night because your back hurts so bad. So you eat a gummy or you smoke and the cannabis relieves you of that pain so you can continue your daily life, the same.
It's a broad spectrum.
Yeah, very, very broad.
It
can do a lot.
For sure. I've even noticed, if you sleep wrong on your neck or something, it can help with that.
Mm-hmm.
Even menstrual cramps, sometimes if people are having pain with that, with severe menstrual cramps, it can help for sure.
And lots of different countries that have all used cannabis have decided that it was good for different reasons, and it just depends on what their ailment was when they found it and decided we're going to try it for this, and it worked for that. So then it's something that different countries, different focuses.
Exactly.
Yes.
The cannabis itself has progressed within these different countries for their medicinal uses.
Oh, and there's a good example.
Which one?
Lack of appetite.
Mm-hmm. Yeah.
For sure. Yeah, because there's a terpene that actually reduces appetite, and so you need to make sure which terpene you're getting because some of them stimulate your appetite. And so depending on your desired effect, you would want to look into which one does what and that kind of thing.
There's quite a few cancer patients that are using chemo, and that kills so much of the good things in your body, causes you not to want to eat, like you cannot even eat, that use cannabis to get some sort of an appetite so then they can eat.
Mm-hmm.
Yes.
Yeah, so
to put weight on.
Exactly. There's kind of a stereotypical aspect to cannabis that you're going to smoke it and get hungry and want to eat. And like in this example, sometimes that is the desired effect, but their specific terpenes will change that effect. And
it's definitely more common, I feel like, to get the munchies. But we're just letting you know there is the opposite end of the spectrum here.
Yeah.
A lot of people also, along with pain relief, use it for nerve damage. So maybe they have had some kind of a surgery or, anything to where they have nerve damage. It can definitely help with that numbing and the phantom limb pain and that kind of a thing.
Mm-hmm. Yeah. Lots of people are affected in their daily life from nerve damage, whether, they can't walk or they just are uncomfortable. And this not necessarily does it prevent or stop the nerve damage, but it makes it manageable. So you can just continue to be yourself and
function as a human.
Exactly.
Yeah.
And this is people we know in our own personal lives who have some of these problems, and cannabis has worked for them.
Yeah, absolutely.
Just in general, sometimes pharmaceuticals, people go down this rabbit hole where they're trying all these things and they become hopeless because none of it's really helping their symptoms. It works for some people. Some people can get on traditional pharmaceuticals and it works for them. But some people, it doesn't affect them as much in the same ways, and they still suffer with the pain. And so this is something for you to look into if you're one of those people.
Another great option.
Struggling.
Yeah.
Another good one is insomnia. There's a lot of people who struggle with being able to go to sleep. Even some people who work night shift and they need to sleep at the opposite hours. They need to sleep during the daytime. Cannabis can really help put you to sleep, and there are certain strains that help keep you asleep. And CBN is a great form of cannabis that can help with that.
Glaucoma, pressure
Eye pressure.
in the eye, yeah.
There's been reports that people with glaucoma, when they use cannabis to help with their symptoms, it's helped reduce the eye pressure by up to 25%.
That's cool.
Yeah, along with the lack of appetite in chemo, it can also help with anti-nausea symptoms. Another category would be mental health reasons, and that is just as much of a medical benefit as all of these physical reasons.
Big one.
And depression and anxiety can be definitely helped a lot with cannabis.
Yeah, absolutely.
Now, you were telling me earlier about some people in our lives have tried cannabis for anxiety and they're already anxious going into it. Maybe they have some worries, and sometimes cannabis will amplify
intensify that.
and
Yeah.
intensify how you're feeling. So one way I think to help is do it for your first time in a setting where you have nothing to be anxious about, by yourself or with your partner or loved one or friend, whoever. That can help minimize the anxiety, and those symptoms will get better as you get more familiar with cannabis in your body. But at first, it can be a little bit intimidating.
Well, there's a lot of variables. So
yes.
let's say you want to try it because you're having chronic pain, but you don't want certain people to find out. That might be your parents, that might be your kids, that might be your pastor or coworker, whoever is in your life that you feel like they're going to judge you. Well, okay, but the pain's so bad, and you realize that this is it's not worth hanging on to that anymore. So you'd go ahead and try it. If that's in the back of your mind, that might be intensifying. You've got to get yourself into a relaxed place and let yourself fully decide that you're ready to try this. And then it doesn't matter.
And it's not adding those anxieties. You are already anxious about that, and it's just amplifying
It doesn't create it.
Yeah, it's understanding that it's just bringing forth more worry. And you also have to understand at the time of the experience that it will end. So whenever you're feeling all of this influx of anxiety and emotions and weird feelings because you're unfamiliar to it, it is going to end. This is not a forever feeling. You have to understand during the experience that it is an experience. It is something that's just happening. Yes. It's a reaction, and keeping that state of mind oftentimes will help you get through things.
It's not going to hurt you.
No.
It's all a mental...
Well, that's the other thing that probably isn't known, is that 0 people have died from overconsumption of cannabis.
Yeah.
The lethal dose is actually impossible to consume in one setting because it's 1,500 pounds of cannabis within 15 minutes. So, I mean, you literally cannot do that.
That's a lot.
Nobody's doing that.
You might green out and throw up if you do too much cannabis, if you take a too strong of an edible, but that takes a lot to get to, and I'm sure as a beginner, you're not going to go doing thousands of milligrams of an edible.
It may feel like you are going to die.
Right.
In your mind, you really might think that.
But nobody.
In your body, it will not happen.
No.
And if you've heard that somebody overdosed, it was not cannabis. It was not, and maybe they were using cannabis, but that was not
another
the cause.
complication.
Yeah, exactly.
Or some other extra something they threw in with it.
Right. People have been using this for thousands of years for medicinal value in different cultures around the world, and it's pretty much impossible to overdose on cannabis.
Seb has a friend that had migraines.
Yeah, so a lot of these examples we know from our own experiences, as well as friends and family and other people who use it in our personal lives that we've seen these effects. I have a friend who had pretty chronic migraines all the way through our childhood, and within months of beginning cannabis, they were no longer. And for the last few years that they've been consuming, they've been pretty much completely free of those symptoms. And something like that is, honestly, pretty life-changing when it affects you so severely at the time.
Yeah, when you don't know when you wake up, are you going
to it's hard.
Get through this day without a debilitating headache.
Mm-hmm.
Yeah.
And some strains can help with that as well.
Right.
I have a friend who gets migraines as well, and sometimes sativa can not work as well. Sativa will maybe they'll still have a little bit of a headache, but the indica takes it away completely. Things like that. So trial and error a little bit. You'll find what works for you.
Yeah, it's all about trial and error.
Yeah.
And one thing about the depression and anxiety aspect, with depression, it might just give you a little bit of joy in your life that you're looking for, that you haven't had, like causing laughter and positive things like that. These things are positive. They're not negative. It's important to have joy in life, and it just brings up your quality of life. It brings you into the moment more, into your present moment. And that can be very empowering, to escape all of the thought patterns that we may enter in life of worries and dwelling on the past, dwelling on the future and what's going to happen. It can help bring you here into the moment and find the joy in that space and in that time.
Once again, we're not doctors, so we're not pretending that we have done these studies. We've not done these clinical trials, but we're digging in and educating ourselves. Kara found something cool about in our research. Kara found something cool about Alzheimer's that is a plaque buildup in your brain, and smoking cannabis can help clear out some of that plaque, and that can add to more cognizance, but more so, I think that's back to the joy again, where Alzheimer's, if you don't know who you are or where you are, that's scary and hard and sad. And if you can add a little bit of joy into something like that, that's good for the patient.
Definitely. It showed that they were less confused, and they were just overall a little bit happier in their life. And one thing that cannabis does is it stops the killing of brain cells. So it can maybe prolong your life a little bit by stopping the Alzheimer process, or at least slowing it down. And same with cancer. Another study that I found was they injected cancerous tumors into rats, and then they treated the rats with THC, and they found that it actually stopped the tumors from spreading into other areas of the body. It didn't necessarily take the tumor completely away, but it stopped it from spreading. One thing that is a plus about cannabis as well is that you cannot get chemically addicted to it. You can maybe form some behavioral patterns where you are dependent on it, and you can go through small withdrawal effects if you stop, such as cravings, irritability. But we all know with a lot of the medications out there or substances, there are withdrawal effects in some of those that can kill you if you stop cold turkey. So this is not one of those substances. You can stop cold turkey and have minimal symptoms, and that is a plus for the medical side, I think.
Yeah, for sure. So knowing that the lethal dose of cannabis is so high, when you go searching for maybe some relief from your insomnia or appetite, now you can keep in your mind that you will be okay, and that the best way to figure out what works best for you is to experiment. So to try different kinds, different ways of ingesting it, multiple different terpenes. You yourself, if you wanted to get that in depth, you can breed your own plants to try to create these medical benefits, as well as reaching out to people that do so, because there are people who are trying to breed specifics for specific things. Obviously, if there's specific terpenes that do it, there's people who want to harness that within their plant. Yeah. So do your own research, do your own trials, your own experiments. all of the such to figure out what actually works best for you, because that's the only way to really find out.
Mm-hmm. And your bud tenders can help you as well.
Mm-hmm.
There's so many things that play into effect, and dosage is one of them, and they can help you if you're a beginner, kind of start smaller and work your way up to the higher levels if that's what you need for your pain levels. So I think that's pretty much all we have to talk about for today about medical benefits of cannabis.
Thanks for tuning in.